Good morning, all. I've been asked to provide you with a presentation as to how I feel I can support the Derby and Derbyshire Local Medical Committee maintain its relevance in the general practice landscape. And I'm delighted to do so. My name is Michael Smith, one of the candidates who is lucky enough to have been invited for interview for the role. And goodness me, what a challenging landscape that is at the moment, with all the structures, the initiatives, the contract changes, the recruitment and retention issues, the effect particularly of COVID-19, the potential effect of Brexit. And on top of all that, GP colleagues and practice managers have to provide a service to patients. So that really is a challenging landscape. And it's a landscape where the LMC, in my view, and in Derby and Derbyshire has been helpful and can continue to be extremely helpful. So how can I support the local medical committee in maintaining its relevance in that challenging landscape? Well, first of all, let's take a look at what core support services can be provided. Core, I mean really what the job description talks about. So first and foremost, obviously, we have the contractual, interpretative, advisory and training services. So we're talking about your core contracts, the general medical, personal medical, the alternative provider. We're talking about primary care network contracts, primary care network agreements, integrated care provider contracts. Then we can go on to things like federation super partnership agreements, GP partnership agreements, practice merger documents, etc., etc. I have 20 years of writing and interpreting and resolving disputes with regard to these documents. So I can advise not only what it says, but what it means in practice. We could also provide statutory, regulatory, interpretive, advisory and training services. Again, I have years of experience of doing this. So we're looking at those statutes that are relevant to care provision. So the NHS Act, which governs contracts, the Mental Health Act, the Mental Capacity Act, GDPR, the DPA, the Health and Safety Act, and things such as CQC regulatory issues, and no doubt the many, many other statutes, regulations that impinge upon practice. I can advise what they say and what they mean. I can also provide guidance, information, interpretive and advisory services with regard to the plethora of guidance out there. Guidance and instructions. So you've got GP Forward View, you've got Investment and Evolution 2019, you've got Primary Care Networks, Sustainability and Transformation Partnership, Integrated Care Systems, Integrated Care Providers, all these, but of all things, what I can do is I can go through documents and I can pick out the salient bits, I can paraphrase those, and I can make sure practice management and GPs receive a smaller document that has all the salient points in to avoid them having to laboriously read the whole document. So forgive my poetic license with the word insurance here, but of course initiatives are only as good as they can be if GP practices and practice managers actually engage with their implementation. So I would, so far as is possible, take into account how busy colleagues, GPs and GP practice managers are. I would, so far as possible, make sure that we get engagement in it, national initiatives, to make sure that we, in a sense, steer those to where we want them to be. So more court support service that I could provide, that could be provided, strategic support and advisory services. So I'm talking about here about the formulation and monitoring of partnership, primary care network, ICS, ICP strategies. I've chaired boards where we've formulated strategies and monitored them. I've run my own business for years. I'm adept at advising and supporting practice managers in their formulation of strategies. Business support and advisory services, once again, from a legal and other perspective, and from the perspective of my having run my own business for many years. So we're looking at issues here such as Brexit, COVID-19, Her Majesty's Revenue and Customs, business structures, so federations, etc., budget setting, recruitment issues. I can be particularly helpful with regard to employment law and have been to GP friends. Procurement law and practice, that's a complicated area of the law. We need to get it right. It needs to be compliant. I can advise in that regard. I can also provide things such as induction sessions to new staff. So referral services, these are integral. So what we do is we would maintain a database of and refer GP practices and practice managers to relevant third-party service providers. So we're talking here about the GP Task Force Limited, pastoral care providers, PCSE, legal services provider. We could even look about issues such as creating panels there to ensure efficacy, quality, and at the best cost. Procurement service providers, project management services providers, any number of third parties, and then I would refer and then liaise to make sure that referral process was at all times going as it ought. And then, of course, the extremely important representative and advocacy services. So what I mean here is a robust, persuasive and tenacious representation of the LMC, GPs, GP practices, and their interest to relevant parties that I've listed there. You know, the GPC, BMA, CCGs, NHSEs, all these acronyms, but CQCs, PCSEs, government meetings and other events as required. We need to advocate and put Derby and Derbyshire GPs' views forward and make sure that they are taken into account, make sure we get what we want. And I would use my advocacy skills and my many years of experience to do a great job in this regard. So I call these enhanced services because essentially they're not necessarily mentioned in the job description, but my experience over the years means that I can provide comprehensive surgery services in these regards. So we're talking about support, assistance and advice with regard to all aspects of CNST GP membership, NHS resolution and GMC involvement in general practice. So issues such as claims coverage, is my claim covered? The management of clinical and non-clinical claims and disciplinary actions. It's lonely. It's lonely being sued. I've been heavily involved in the trust side of these issues in the past. It's lonely being sued, and a friendly face that you know, who is independent and objective, can be very supportive, can assist you, and can advise you as to the process and what's going on and the reason for decisions being made, and could also advocate if GP and practice management colleagues disagree with decisions made. So again, risk management, I've had a lot of involvement in risk management. That's incident reporting systems, risk measurement, allocation, learning management and mitigation actions. I can help practice management colleagues in that regard. So we've had big issues such as the a failure of Capita, the PCSE provider, and due to that failure, of course, GP practices were owed money. So what I can do there via webinar or personally, if necessary, I can take practice management colleagues through the process, the formal process, cost recovery. So the issue of proceedings, small claims or otherwise, take them through that, how they can do it, the various processes, and maintain that support through to the end of those processes. So I've done numerous health and safety presentations in the past. I've undertaken these both to clients and as a lecturer at Loughborough University on their hazard risk management course. I could undertake that sort of training. In particular, I could provide contract negotiation and drafting services. So when you're looking at GP partnership agreements, primary care network agreements, I can actually undertake that drafting and negotiation service for practice management colleagues. Potential that has income generative potential, obviously, for the LMC, subject to resolving any indemnity issues. Procurement advisory services. So what we're talking about there is accessing funded and unfunded support and other services in the best, most cost efficacious way possible. Excuse me. And then, of course, complaints management services. I have many years of looking at complaints, making sure they're investigated and responded to in the best possible way. One thing we do not need, in addition to all the other stresses, is a complaint that goes on and on and on because it hasn't been adequately dealt with. And of course, through my legal training and my expertise and my experience, I can support, assist and advise practice management colleagues on their disputes and appellate processes when they have arguments with the NHSE or issues they wish to raise with the NHSE. So that's the core and enhanced services that can be provided. Well, what services should the LMC provide? And first and foremost, those required by GPs and GP practices. Sounds simple, but we need to make sure at all times that we remain relevant, and that means we provide services required by GPs and GP practices. So in order to achieve that, we need to be in a continuous dialogue conversation with GPs and practice management staff. We need to engage those people, and we will engage those people by providing advice and support that is at all times of the highest quality, with an absolute focus on attention to detail that's relevant, required, and of course timely. If we're asked for advice, we need to provide it as soon as we are able, and keep people in that loop if we need to take a little more time because we need to research. We need to listen, analyze, and advise accordingly. Extremely important. We need our advice to be right. We need our advice to answer the questions that are asked. So what would I do? I would probably undoubtedly create a presentation outlining how I can help GPs and GP practices. Should I be engaged? I would conduct an initial questionnaire. How is LMC business contract support function perceived by its users? How can it improve? I would then undertake annual questionnaires. What are we doing right? What are we doing wrong? What can we improve? We need to remain relevant. We need to make sure that what we're doing is helpful. We need to improve what we're doing at all times, constant improvement. And we can only do that by the continuous dialogue, by asking people what's going wrong, what's going right, how can we improve. So how will I provide these services? Well, obviously in a high quality, interpersonal, friendly and informative manner by a trained, interested and engaged team. Now, of course, at this stage, I don't know precisely the details of my team, but what I would ensure in leading that team is that workloads and time are properly managed, that achievable but stretched targets are set, that all contributions are valued, that all opinions and ideas are heard, that all members are nurtured, motivated, empowered, and empowered to work to their best ability, and that training needs are addressed. We need an interested and engaged team to provide the services we need to provide. So we need to provide our support in a way that suits our audience, provided that's possible, and hopefully we'll make it possible on as many occasions as we can. So we need to be an open door service. We need to be online, that's probably preferred, but we can be in person too. We need to look at provision via webinars, presentations, training sessions, one-to-ones, Zoom, team meetings, written but plain English briefings, detailed but plain English advisory notes, monthly newsletters, 24/7 in case of emergency. We really do need to make use of all available and affordable IT communication platforms, and we need to make best use and most effective use of our limited resources. That is essential. So in accordance with an agreed strategy inclusive of an agreed communication plan, that I would seek to agree with the LMC executive and senior management by way of things such as the creation of subject-specific frequently asked questions, weekly webinars. Now, I understand that this one today, because I wish to impart quite a lot of information, is somewhat dry, but we try to make this as informative, amusing, and audience participative as possible, with topics chosen by users. And I would look to potentially revamp and better organize the website, make it less reiterative. Of course, I haven't logged in, so I don't know what's behind the front end of the platform, but at the moment, I think it could be improved in terms of its organization. And our services will be provided in conjunction at all times with colleagues. So I'm talking about here the GP Task Force, which has some really, really excellent initiatives, such as the medical chambers, the wraparound care. These are really super initiatives. So I'd work with the GP Task Force and required other relevant third-party providers. And I would provide all required advice to both the local medical committee and the GP Task Force. So, having looked at what services could be provided, what enhanced services can be provided, how we would provide those services, if we get this right, and I will be determined to do this and maintain the Derby and Derbyshire view, or the view of Derby and Derbyshire, which is that it's a really excellent local medical committee. I would want to maintain that and make it better. And if we get what I'm outlining in this presentation right, what will the outcome be? And this is what I would seek to achieve each and every day of working with the local medical committee. I would seek to achieve a highly relevant, required, seen as essential, best-in-class service that members value, rely upon, and could not do without. Thank you very much. I hope that's been informative, and I look forward to meeting you next week.